And since 2016, he has supported members with WCB claim issues and has provided professional representation through all levels of workers' compensation appeals. Prior to joining MGEU, David spent several years at the Worker Advisor's Office as an intake officer, as a worker advisor, and manager of the program, assisting injured Manitobans with WCB appeals. Before I hand the microphone over to David, I'd like to acknowledge today that we are gathered on Treaty 1 territory, that Manitoba is located on the territories of the Anishinaabe, the Anishinaabe, the Dakota Oweite, the Denisoulene, and the Naheithawig nations, and on the national homeland of the Red River Métis Nation. We acknowledge that northern Manitoba includes territories of the Inuit. And as we gather today on Treaty 1, we recognize Treaty 3, in particular Shoal Lake 40, First Nation, which is the source of Winnipeg's clean drinking water. We also acknowledge Treaty 5, including Nelson River, which provides us with access to most of our electricity. The Occupational Health Center acknowledges the devastating, the lasting and ongoing impacts of settler colonialism on Indigenous peoples and the deep lack of action towards truth and reconciliation. We commit ourselves to active accountability, to truth, to justice, and equity and reconciliation. And a quick note before I hand the mic over to David, in case I haven't said it, we will be recording the first 45 minutes of David's presentation. The Q&A after and the peer support group will not be recorded. And having said that, welcome, David, and thanks so much for being with us today.
Good morning, and thank you. Thanks, everybody, for joining us today with the Occupational Health Center and talking about psychological injuries and the WCB. I think this is nothing new for probably most folks that are listening today and observing. Statistically, about 40% of Canadians will experience a disability related to mental illness or mental wellness in their lifetime. But just 5% of the claims that are filed with the Workers' Compensation Board of Manitoba are for psychological injuries. The vast majority are still for physical injuries. And of that number, according to the reports that I've received, about 40% of claims that are made within the Workers' Compensation Board of Manitoba for psychological injury are denied. So not a lot of claims, but a lot of claims where things aren't going as smoothly as we would hope. And from my perspective here at the MGEU, I think it was 38% of members, I can't see my number there, but 38% of members that are coming to me for assistance with their specific workers' compensation claim have had a psychological injury. And so we're saying that they've experienced some sort of traumatic event in the workplace, bullying, harassment, perhaps a robbery, something in the correctional system that's resulted in a specific psychological injury, not as a result of a physical injury. But another 19% of people that are coming to my office for assistance have psychological difficulties, either a consequence of that injury or somehow relevant to their WCB claim. In some cases, they have struggled with mental illness prior to their workplace injury, and that becomes a question of how it's contributing to their recovery. And in other instances, it's a secondary injury. As an example, somebody who sustains a back injury and they're off work for a considerable amount of time, that's not good for your mental health, and somebody can become depressed. And so the WCB can accept responsibility for a secondary psychological injury where there's a primary physical injury. So a lot of people that are struggling with Workers' Compensation Board claims for psychological injuries are coming to the union for assistance. So the workers' compensation system is governed by a provincial act. The Workers' Compensation Act speaks to what is an accident. And an accident, as we characterize it, and Lisa and I were speaking earlier about, the word is probably outdated with respect to what we're talking about in a lot of cases, but nonetheless, legislation still characterizes an accident as a chance event occasioned by a physical or natural cause. And that could be something like a fire or an explosion in the workplace. A willful and an intentional act that's not the act of the worker, Something like that could be a robbery. It could be harassment. It could be an assault. The definition goes on to say that an event or condition or a combination of event or conditions related to the worker's work or workplace, which really sounds really broad. And it is broad in this context. We'll get into it a little bit later of what that means with respect to the application and adjudication of these claims, but it has to result in a personal injury. And that injury could include an occupational disease, it could include PTSD, or an acute reaction to a traumatic event. So each province has different legislation, and in Manitoba, this is how we're characterizing an accident. So what is not an accident? The Act says any change with respect to an employment of a worker, that could be a promotion, transfer, demotion, layoff, termination. It could be scheduling of hours. It could be assignment of the least desirable kind of work. Those things are not considered an accident, and it's not something that the WCB would consider a claim for. Any event or condition or combination of events or conditions that results in mental stress is not covered unless it's an acute reaction to a traumatic event or PTSD. So in the former slide, where it sounds like it covers pretty much everything, this definition suggests that's not actually the case. And we go on further to explain that in Manitoba, since 2016, the Workers' Compensation Act has provided a presumption. And that means that if a worker is exposed to a traumatic event, and a traumatic event in this context is described and defined by the DSM-5, which is what psychologists and psychiatrists use for diagnosing mental illness. If you were exposed to a traumatic event as defined there, and you were diagnosed with PTSD by a physician or psychologist, then the WCB is required to accept responsibility for your claim. And the intent of this is to quicken the adjudication process so that injured workers get access to treatment sooner. The sooner they get access to treatment, hopefully the sooner they can feel better, and hopefully the sooner that they can get back to work. This has been in on the books in terms of the legislation for nearly a decade now, and Manitoba was a leader in introducing this back in 2016 because it's quite broad and it doesn't specify that you have to be involved in a certain type of work to be covered by that presumption. So there's the legislation is set out by the province of Manitoba. The government of Manitoba sets that out, and we'll talk about it a little bit later, that will actually be subject of review publicly over the course of the next 12 months or so. Under the legislation is the WCB's policies. And so the policy is actually established by the Workers' Compensation Board's Board of Directors. And so this is something that can change over the course of time. What you see in front of you here is a definition from the adjudication of psychological injuries policy that is in place right now. It's backdated to, I believe, about 2023. Prior to that, there's different definitions, and prior to that is different definitions. So depending on when your injury occurred, the WCB will apply the correct policy. So if you're injured today, then this is the policy that's going to take place. Some injured workers are filing claims with the WCB where their traumatic events have occurred many years ago. And if that's the case, then the WCB has to go back to the adjudication policy that would apply in that period of time. So sometimes those definitions are going to be varied and they won't necessarily make sense to what we're talking about today. But a traumatic event is defined by the WCB is involving direct exposure to actual or threatened violence in a specific time or place. Not that long ago, the WCB also included workload, something that is still relatively new in terms of the claim loads. I think the last count that there was under a dozen claims had been filed for excess workload. But for the last couple of years, the Workers' Compensation Board can and will accept psychological injury claims when there's an excessive workload that results in an injury to a worker. So it's a little bit odd the way they've characterized traumatic events to include, hazardous events, traumatic events, but also workload. I expect that once the act is changed and reviewed over the course of time, that they're probably going to move that into somewhere that's a little bit more appropriate. It just seems odd in terms of fitment for me. Now, the policy also goes on to explain what harassment means. Objectionable conduct creates risk to health of a worker, or severe conduct that adversely affects the worker's psychological or physical well-being. skipped ahead here. Bullying is also, sorry, I'm just gonna try and move this over. Bullying is conduct that is intended to or reasonably should have been known uh, to demean, humiliate, isolate an individual or results in an individual's loss of dignity. Bullying often involves a real or perceived difference in authority between parties. Now, I think that it's important to note that this is how the Workers' Compensation Board defines bullying and harassment, whereas workplace safety and health has varied definitions, and individual workplaces that have respectful workplace policies may have different definitions as well. So one of the problems that I'll address in a little bit later on is there isn't a consistent understanding of what harassment means. And that's because employers might interpret it differently. Workplace safety and health branch might interpret it differently than the Workers' Compensation Board does. So you can have a situation where there may be confirmed harassment in the workplace, but that doesn't necessarily mean that the WCB is going to be accepting responsibility for that claim if it doesn't meet their definition. So again, from the policy, there's non-traumatic mental stress. So the exclusions that I referenced earlier were actually coming from the Act, and these ones are coming from the policy. So anything that's a non-traumatic event or series of non-traumatic events that produce mental stress, such as the daily pressures of work and life, are not accidents. It suggests that a degree of mental stress is endemic to life, and in most cases, it's not the WCB's responsibility. It's not covered by the Act. Similarly, events and actions originating out of the employee-employer relationship. So everyday workplace events between an employer and worker are not considered accidents. And so when I said earlier there's exclusions, these exclusions under the policy, in my view, expand the exclusions considerably. Because what is a workplace? What is a everyday workplace event? Well, in a safe workplace, you're not going to have a lot of everyday workplace events that are going to be causing stress to a worker. But to a high stress workplace or a toxic work environment, perhaps every day is traumatic. And so what is considered an everyday workplace event is going to be difficult to interpret, and it's going to be subject to varied interpretations. What you and I might think is a normal thing might not be normal depending on your employment context. So those are things that the WCB will exclude from compensation, but there's a variety of different ways that the WCB can accept it. And I already explained that, in terms of a psychological injury, the WCB can accept responsibility for a claim where the psychological injury is the direct result of an accident. And an accident could be an assault, or accident could be harassment, an accident could be a variety of different things. But a lot of times members will say, the WCB is denied responsibility because I have a pre-existing condition, or they haven't denied it necessarily yet, but the worker is apprehensive of filing a claim because they already had a pre-existing mental health condition, and they're not certain that the WCB is going to accept responsibility. In fact, they think that that's going to be a detriment to their claim. Well, there is a WCB policy that says that they'll actually accept responsibility when an accident makes a pre-existing condition that could be physical or psychological, makes it worse. And that policy talks about an aggravation as being a time-limited worsening, or an enhancement where there's a pre-existing condition that's permanently made worse. And so it's important to understand this relevance of this policy, because the WCB takes you as you are when you're coming into the workplace. And so having a pre-existing condition isn't necessarily a detriment to a claim. In a lot of cases, the WCB will acknowledge that the pre-existing condition may actually make you susceptible for injury, right? And that's the same for a physical injury as well as a psychological injury. If you have a back condition, you previously had a disc injury, and you're in a physical job, lifting boxes day in and day out, with a back disc injury can put you at risk for injury. And similarly, if you have a pre-existing condition of anxiety and you're in a situation where your work is stressful, perhaps that anxiety is going to be becoming worse depending on the situation. And so the WCB can accept responsibility in that case. I also suggested that WCB can accept responsibility when there's a secondary injury. So a psychological injury can be secondary to a physical injury. And so if, as the example was, if you're at home recovering from a back injury and you feel isolated because you're no longer in the workplace, you're no longer seeing your colleagues and your friends, and you don't know what your prognosis is, and you're in pain on a daily basis, well, that can certainly be a struggle for many workers. And so if it rises to the degree that that is actually resulting in a mental health injury, then the WCB can accept responsibility if it's found to be predominantly attributable to that physical injury that they've already accepted responsibility for. So another policy where it explains that the WCB can accept responsibility for an injury. So these claims are incredibly complex and incredibly difficult. And for physical injuries like a sprain, strain, I believe the WCB's standard is to have claims accepted and paid within 7 days. In cases of psychological injury, I can tell you that that's simply not the case for the vast majority of claims. They're complex for a number of reasons, which I'll speak to here. Workers often don't recognize how work has impacted them, and they don't either recognize or acknowledge the existence of an injury. Quite often, members are coming to my office after their claim has been denied, and they're telling me that it wasn't them who, in fact, noticed that they were injured. It was their colleagues who said, "You know what? You're just not yourself anymore," or their family who found that they were argumentative or isolating themselves. And so sometimes it can take months, if not years, of struggling with mental illness in silence before it's actually recognized. And once it's recognized, then it can be reported to the WCB. But obviously, if you're not aware that you've been injured, you're not filing a claim, and you're certainly not looking for assistance with respect to recovery. So that's not an uncommon problem with respect to psychological injury claims. And so when there's a delay, the WCB is looking to do an investigation, and the event that may have caused that injury, if it's 2 or 3 years prior, it's going to be a lot more difficult to confirm the existence of that event as opposed to something that happened maybe just last week. Stigma continues to be a problem associated with mental illness and injuries, especially depending on what sort of occupation you're in. There's oftentimes a belief that you have to suck it up, and that exposure to X, Y, or Z in the workplace is just the nature of the job. But that's simply not the case. Every worker is entitled to go to work and to come home healthy and safely. And so sometimes in different workplaces, people are reluctant to report injuries because they feel that their colleagues are going to be viewing them in a negative light. Now, I believe that that's actually changing now with the course of an understanding of mental illness, that people are more likely to come forward and to look for help and to file a claim with the WCB. But it still remains a problem. Also, subjective nature of symptoms. What's normal? Especially when something happens over the course of time, your normal may change over the course of time. So you just may not feel the same as you did before. Maybe that's just how things work over the course of time, but sometimes it's I just don't feel well, and it's a matter of depression, and people don't recognize that feeling down or feeling negative or feeling uncomfortable with their employment circumstances may actually be an indicator that there's something wrong, that they're struggling with a psychological injury. The perception of experiences, in cases of bullying, this is extremely common, where people feel that they're being micromanaged by their boss. They feel that they're under extreme scrutiny, and they feel that, potentially that their boss is harassing them. But at the flip side, a manager who's trying to get work done through their staff and paying attention and trying to coach them, coaching a staff person could be perceived as harassment depending on the context and that individual experience. So these matters are simply not black and white, unfortunately. Something that remains a problem for psychological injuries is access to healthcare for diagnosis and treatment is still far more limited than with physical injuries. I think if anybody were to sprain their ankle, they'd know exactly what to do and where to go. You can go to a walk-in clinic, you can go to Emerge, you can maybe go to your family doctor to get checked out. But if you're not feeling well mentally, what do you do? Where do you go? I think even if you do know where to go, the access to treatment is just not the same when you compare it to physical injuries. Another common problem is, hey, everybody comes to the workplace with their own uh, baggage to a degree. So how do you and how does the WCB sort out what's a personal stressor? Feeling that you need to, pay the bills, put groceries in the fridge and food on the table, uh, caring for your family, elders, taking care of your elderly parents. There's a lot of things that can stress a person, both inside and outside the workplace. And so the WCB, when they're looking at these claims, have to kind of differentiate what is here the WCB's responsibility, what is work related, and what is not. It's very difficult to tease those apart in a lot of cases and to figure out what is actually going on, what is it that's causing stress and disability. And I've alluded to it already. The relationship with employment matters. I mean, sometimes work can be difficult. Employers can be difficult and challenging depending on the scenario, and workers can be difficult and challenging depending on the scenario. So, where's the line between performance management, attendance management, bullying, and harassment? I'll say it depends on the scenario, right? It really depends. It boils down to the case. Uh, the policy suggested earlier that the WCB will not cover labor relation things, right? So, of course, if an employer were to terminate an employee, that's going to be stressful, but that's not necessarily going to be a workers' compensation board claim based on the policy. However, depending on how it's done, right? If the termination occurs within the context of an HR office and it's done in a respectful manner, that's your employer's right and responsibility to do that. But if your manager comes into the lunchroom when you're enjoying lunch with your colleagues and starts calling you names and pointing at you and saying that you're incompetent and these sorts of things and lets you go in that manner, well, that's not reasonable anymore. So I think that probably something that the WCB would consider. So not all things are going to be as black and white as we would think. So, some additional challenges with respect to workers' compensation board claims and how they're difficult. In my opinion, the presumption that the government introduced back in 2016 is far underutilized by the WCB. I know that was intended to ensure that workers are getting access to treatment as quickly as possible. And if it's determined over the course of an investigation that their injury isn't actually work-related, then that's something that's discovered later on, and the claim can be canceled if the evidence supports that decision. But in my opinion, what's happening now is actually that the WCB over-investigates claims and that they take many months in a lot of cases for a claim to be investigated before the worker is going to be covered potentially and provided with the treatment to help recover from that injury. Another problem I often see is that the WCB doesn't necessarily do its own investigation, but they'll rely on the employer's investigation into what happened. Case in point, workplace harassment, bullying. Most of the employers that we deal with here at the MGU have respectful workplace policies, and that's often the first stop. For an injured worker, they tell their employer that they've been subjected to bullying and harassment. The employer does investigation, and they may find that that's corroborated or not. But the problem here is that the WCB will contact the employer and say, "Hey, what did you find? What was the outcome of your investigation?" And if that investigation found that the claim was unsubstantiated, then that may be the end of the WCB's investigation. And in my view, that's problematic because for a few different reasons, actually. The employer's policy on respectful workplace may have a different definition, as I suggested before, than the Workers' Compensation Board. So they're not necessarily using the same test. but they don't necessarily know how thorough that investigation was. Uh, so for the WCB to rely on what the employer's investigation outcome is really puts the worker at a disadvantage. And coupled with that, one of the challenges in this scenario as well is once a worker is off work with a psychological injury, they're often not participating in any employer's investigations. So the employer may put an investigation on hold, and if that's the case, and the WCB is looking to work with and rely on the employer's investigation, then the claim is often put on hold as well. So it gets into a situation where nothing actually is being accomplished. In my experience, the WCB also prefers discrete traumatic events, right? And maybe not prefers is the adequate word, but it's easier to point to one specific event, confirm that it occurred, and say, yes, that incident resulted in this injury. That's clear. It's less clear when it's an exposure to multiple traumatic events over the course of time, and it's not clear to the adjudicator which one might have caused that injury. Don't get me wrong, they can certainly accept responsibility for cumulative injuries as well, but it's far more difficult to investigate when it's not clear what the inciting event was. In my view, the definition of trauma is limited under the Workers' Compensation Act and the policies, and so there's a lot of things that are excluded, and those exclusions are, in my view, broadly interpreted and applied. Those challenges are certainly problematic in terms of how WCB accepts and denies responsibility for claims, because I think over the course of this conversation as well, people don't necessarily know what the WCB covers and doesn't cover. When you see a billboard on the side of the street that says work shouldn't hurt, it implies that, anything work related is going to be covered by the WCB. But when we talk about the exclusions under the legislation and under the policy, that's simply not the case. And unfortunately, I think a lot of injured workers are misinformed about that and falsely assume that there's going to be coverage. And employers also don't necessarily know what's covered and what's not covered, which can impact how these claims are adjudicated and investigated. In my experience, psychological injuries are often denied because workers are reluctant to report to their employer. Uh, it's certainly the case when the employer is in part responsible for their injury. The policy talking about bullying and harassment suggests that there's often a difference in authority within the workplace, and that can play a role in harassment. So knowing that your bully or aggressor may be the person that you're supposed to report to creates a challenge, because workers are going to be unlikely to bring this up when they don't believe that they're going to be supported by their employer. Workers often are reluctant to get a psychological assessment, or psychological assistance, perhaps is the better term. It's really an invasive type of thing to talk about how you're feeling and why you're feeling that way. And not everybody is comfortable to open up and share. But in order for the Workers' Compensation Board to accept responsibility for an injury, that's necessary. And so having access to somebody who you trust and you expect will support your claim and recovery is important. But if you don't have that information at hand, then the WCB isn't going to have that information to rely on in the adjudication of the claim. Another challenge here is diagnostic impressions by psychologists and psychiatrists and by physicians may vary. I've seen quite a few claims where treatment providers will say, this patient appears to present with symptoms consistent with PTSD. At the same time, the Workers' Compensation Board has consultants who say, well, from my perspective, the symptoms that have been reported don't meet that criteria. Well, if the WCB's doctor says one thing and your doctor says another, well, that may become a problem in terms of how the WCB is going to be looking at the claim, because we don't necessarily know with any degree of certainty what's going on. And of course, having a broken bone can be confirmed by an X-ray. Any sort of doctor is going to be able to confirm that pretty clearly. It's objectively clear. But psychological injuries and mental illnesses can present very differently. And so, depending on how that assessment goes, can impact the viability of a workers' compensation board claim. I already suggested earlier that delays in reporting can impair investigations, and so that's the delays in reporting. I'm talking about to the workers' compensation board, but also to the employer. If we're talking about weeks, days, it's not a big deal. But when we're talking about months, in some cases years, it's difficult to go back to figure out what happened and to confirm that the exposure to a traumatic event occurred. In some occupationals, like correctional officers that we work with, and paramedics and the like, there's documentation relating to every interaction they have with inmates or patients. And so there is going to be evidence there so that the WCB can go after and get to confirm the occurrence of instances. But in a lot of different occupations, there isn't going to be that sort of degree of documentation. So then it's going to be dependent on recollections of any witnesses that may have been there, or lack thereof. We often deal with people that work in home care and are working alone. And so, if you don't report an injury or an incident to your employer at all or promptly, and there are no witnesses, it's going to be difficult for the WCB to confirm that occurrence occurred. And if they can't confirm it, in all likelihood, there could be a negative outcome with respect to the claim. Now, I'm not sure if there's many employers watching today, but in my experience dealing with the WCB and the employers that the MGU represents, they're often very keenly challenging the acceptability of claims. And unfortunately, because the Workers' Compensation Board claims are funded by employer premiums, it's a financial interest in most cases where employers seek to challenge the acceptability of these claims because it costs a lot of money. It's a small amount of claims that the WCB deals with, but claims for psychological injury are very expensive for them, and the duration of disability in psychological injuries far exceeds the normal duration of disability with respect to physical injuries. So when an employer is not supportive of their workers' claim and potentially even challenging what they've been reporting to the WCB, then that's likely going to have a detrimental impact on the acceptance of that claim, unfortunately. Other reasons these claims are denied: separating out personal and work-related stressors. As I said before, I mean, everybody comes to work with a variety of different stressors, and for the WCB to figure out, what's really going on, and what is it that is causing you to be off work and to need mental health treatment, can be very difficult. And so when these claims become messy and there's a lot of different things going on, it's very difficult to kind of separate things out and to figure out and point to work as being the primary or a necessary stressor for a claim to be accepted. So I'll often see claims denied because there's other personal factors that the WCB considers are more problematic and more injurious to the worker than the employment-related stressors that would be covered. As I said before, not all work-related stressors are covered by the WCB. The definitions over the course of time have improved to a significant degree, in my opinion, but there's still a lot of exemptions, and those exemptions are not well understood by the public, and so a lot of claims get denied simply because workers don't know that what they're claiming isn't going to be covered by the WCB. And perhaps over the course of time, that's going to change. But at this point, that's still the case. And people often experience events differently, right? Depending on what you're used to in your work environment. If you're working in a shop and there's a lot of foul language and horseplay, that may be normal. That may be normal for the workplace, but that doesn't necessarily mean that's normal for the worker, right? Coming into a workplace that's maybe considered hostile for somebody who's not familiar with it, And so everybody's going to experience events differently, and it's really not up to the workplace to defend what they're doing. It's up to the impact on the worker, which is going to decide how that claim is going to be adjudicated by the WCB. As I said before, there's often no witnesses to these sorts of events, especially when it's, interpersonal harassment. Perhaps it's your supervisor and you. They're not going to be witness to anybody else in the workplace. So then it'll be coming down to whose version of events is more credible, you or your supervisor, you or your bully. If there's no other witnesses, it's going to be up to the adjudicator to decide who's more credible and what do you base that on. It's a very difficult decision to make. And finally, here, subjective symptoms can be difficult to validate, right? It's not like an X-ray where you can confirm that there's been a fracture. When we're talking about psychological injuries and illness, this is happening internally, and it's very difficult for the WCB to quantify and to validate a worker's experience. And if that's not readily possible, that may result in the claim being denied. So if it isn't clear based on what I've been talking about already, these injuries are very difficult to kind of parse out and decide what's acceptable and not, because it's quite often just a matter of perception in terms of what it is. Oftentimes I'll hear workers say that, I'm done, I'm burnt out, I'm just tired of my job. Well, I can tell you, if you say that to the Workers' Compensation Board, it's very likely that your claim is going to be denied. That use of the word burnout is a red flag. However, that may be just you describing how you've been subjected to repeated traumatic events over the course of your career. And so it's exactly the same thing. It's just a matter of how it's presented and how it's understood. The daily pressures of work versus excess work. What's normal, right? The WCB's policy talks about excessive and unusual. When we are dealing with paramedics who are working 12-hour shifts day after day, is that excessive? I would say probably it is. Is it unusual? Unfortunately not. So for the Workers' Compensation Board to say, well, we can accept responsibility, but it has to be an excessive and unusual. If everybody's working excessive and unusual hours, then by definition, it's not something that WCB accepts. So again, it's a matter of perception. What's the difference between a difficult supervisor, a demanding supervisor, somebody who's really aggressive or assertive in terms of getting the job done, versus harassment? In my opinion, there can be really no distinction aside from perception. So it really depends on what's happening in the workplace. Everyday workplace events versus bullying, same sort of thing. Everybody's workplace is different, and what's normal or what's considered normal in one workplace, maybe it shouldn't be considered normal. And so just because it's normalized doesn't mean that the WCB should be excluding it from coverage. If everybody's being toxic in the workplace and you're subjected to an injury as a result of that, then it is something that WCB, in my view, should be accepting responsibility for. Really quickly, in terms of the appeal process, the WCB's policy 2010 reconsiderations outlines the steps, and they're listed here on the screen. Compensation services, that's the department name for the adjudicators and the case managers. And the WCB's decision, those are the folks who are making the decisions to accept a claim, to deny a claim, to pay benefits or not pay benefits. And their policy says if you have any new information, if you have a different interpretation, if you want to discuss the matter, it's the case manager, adjudicator, the decision maker where you go first. And the intent of that is to make sure that people have an understanding of why a decision is made, why a worker, the intent is to have a worker understand why the WCB is making that decision, but at the same time, having the worker perhaps explain why they disagree with the decision. This can be informally, it can be an email, it can be a phone call, and it's relatively quick and easy. But the board's policy says that you have to do that first. The second step is the WCB's review office. So that's an internal file review done by more senior staff at the WCB based on a written submission. And so this is a little bit of a more formal process. Generally speaking, when I'm presenting an appeal, it's a letter. explaining why we've disagree with the WCB's decision, and kind of going through the information that's on the claim file and explaining our position. In all cases, the employers also have the right to participate in this process. They have the right to access the workers' claim file, and they have the right to respond to the workers' appeal. And so this is something that takes anywhere from 8 to 12 weeks. And unfortunately, statistically, about 75% of claims or appeals are rejected at that level. And the Appeal Commission is the final and formal level of appeal with respect to WCB claims. It's set up independently of the Workers' Compensation Board by the government, and those folks make decisions after an actual conversation about the WCB's decision. It can take anywhere from 4 to 6 months to get to a hearing, and it can take a couple of months for a decision. At this point, the annual report coming out of the Appeal Commission is suggesting in the last couple of years, it's about a 50-50 split between those appeals that are accepted and those appeals that are rejected. So the odds of success are considerably better at the Appeal Commission level. Just finally, I've talked about, at length what the WCB covers and doesn't cover, and the policy that's in play right now and the act that's been in play for a while. The government has announced that a review of the Workers' Compensation Board is going to occur over the next 12 months. A committee has been struck, and they have a mandate to review the act and to report back to government, I believe, by early 2027. So there's going to be some sort of consultation process, and I think everybody has different ideas of what might be good to see in a revised Workers' Compensation Act. So a couple of things that I put forward here in terms of how things should change is expanding the mandatory coverage for WCB so that more workers are protected. There's a lot of industries that aren't covered right now, and I think the more workers that are protected by the WCB, the better off we all are. Of course, I've mentioned a lot of different exemptions. I think those exemptions have to be reduced so that more workplace injuries, in fact, all workplace injuries, psychological injuries, to be covered by the WCB. I've also mentioned that employer involvement briefly in terms of the appeal process. Well, they're also involved in the adjudication process, and in my view, that can be a detrimental impact to the WCB's investigation. So what I would recommend is that the employer have limited involvement in the adjudication process. Let the WCB do its investigation. Let the WCB decide whether that claim is acceptable or not. And finally, broaden stakeholder consultation process so that healthcare providers and workers and unions and employers all have the ability to consult when policies are being changed, updated, and adopted. Currently, it's the board of directors that do it, and they do it alone. But I think how impactful these policies are, I think it really is important that stakeholders in the community do have the ability to speak up and to explain why they think that those policies should be changed. And finally, a question mark, because I know we don't have a ton of time, but if anybody had their thoughts on what and how the Compensation Act should be changed, I think it's a discussion point that certainly needs to be addressed over the next 12 months so that the legislation is changed for the better so that injured workers are better protected. And finally, we have questions. A couple of minutes left yet still, so I'm happy to answer any questions that you may have.
Thank you so much, David. That was excellent. We really appreciate you taking the time to share your expertise with us. It's very valuable, and I think it's such an important topic, in particular right now with everything that's going on. Just one quick comment that I'll make before asking folks here. So as David mentioned, we do have a few minutes for Q&A. So if you'd like to ask personally a question of David, just raise your hand and Tiffany and I will get to you, and then you can ask David the question.